Hello, and welcome to my YouTube channel at Alexandru. On this channel you will find 1. Quality news, 2. Animals, reptiles, snakes, plus other short clips 3. Business and economy, 4. Moments of relaxation, wonderful places in the world, 5. Cryptocurrencies and everything about cryptocurrencies, 6. News vertical bar information about cryptocurrencies plus methods of making money online on the net, and a new podcast visible on my YouTube channel at Alexandru. 7. Culinary networks and traditional foods from various countries. In today's clip we will talk about what is the Ebola virus, Ebola, modes of transmission, symptoms and treatment. Infection with the Ebola virus or hemorrhagic fever is an extremely serious disease, and the most common in West Africa, with a mortality rate between 25%–90% of infected persons. The first diagnosis of Ebola virus infection dates back to 1976, in the Democratic Republic of the Congo, in Africa, and the next cases will be reported in Africa as well. The Ebola virus has a long incubation period of 2 to 21 days and is transmitted through contact with the blood or secretions of an infected person, either directly or through contaminated surfaces, needles or medical equipment. The probability of transmission is higher in the early stage of the disease, when although the contagiousness is low, there is a risk of unprotected contacts, and in the late stage, when confirmed patients with high viral load undergo invasive medical procedures, with the risk of contamination. 5 species of the genus Ebolavirus in the family Filoviridae are currently known: Zre ebolavirus, Sudan ebolavirus, Reston ebolavirus, Ta Forest ebolavirus, and Bundibugyo ebolavirus. Infection with any of these except Reston ebolavirus results in Ebola hemorrhagic fever. The Ebola virus is present in wild animals, fruit bats, chimpanzees, gorillas and antelopes. In the area of sub-Saharan Africa, human infections were achieved through direct contact with these animals. Transmission. The incubation period is usually between 4 and 10 days, but can vary from 2 days to 21 days. From when a person is infected until symptoms begin to appear, Ebola is transmitted through direct contact with the blood, secretions, tissues, organs, or other body fluids of an infected person, living or deceased. Transmission of the virus can also be done through materials contaminated with the respective fluids, coming from an infected person. The Ebola virus can also be transmitted through unprotected sexual contact with patients recently cured of this disease. The virus can be present in the semen up to 3 months after the actual cure. Handling corpses without proper protective equipment and burial rituals play an important role in disease transmission. Airborne transmission has not been demonstrated. The Ebola virus is classified as Biosafety Level 4, BSL4, Risk Level 4, and requires special protective measures. Viruses can survive in liquid media or on dry surfaces for several days. They can be inactivated by gamma irradiation, heating at 600 C for 60 minutes or boiling for 5 minutes, and are sensitive to sodium hypochlorite and other disinfectants. Freezing does not inactivate Ebola viruses. The periods when the risk of secondary transmission is greatest include the early and late phases of the disease. The early stage, when patients do not yet show high contagiousness, but contacts occur without adequate protection. The late stage, after confirmation of infection, when patients may have high viral loads, while undergoing invasive procedures prone to contamination in intensive care units. The groups exposed to the risk of infection with the Ebola virus are medical workers, in case of non-compliance with precautionary and infection control measures, family members, or other people in close contact with infected people, people who have direct contact with the organs or substrates of the deceased, as part of the funeral ceremonies, people who come into contact with infected wild animals, e.g., handling the meat of wild animals hunted for food, or with infected bats. Symptom. It should be noted that the initial symptoms of the disease are not extremely specific and are often similar to those of other more common diseases, such as colds or malaria. The distinctive symptoms are much more severe. Initial signs: fever, weakness, muscle and joint pain, headaches, lack of appetite, diarrhea, sometimes containing traces of blood or mucus, nausea and vomiting. Distinctive signs: bleeding from the nose, gums or skin, vomiting, bloody stools, skin rash, sore throat, difficulties in swallowing. In the advanced stages, some patients may experience abundant internal and external bleeding and multiple organ failure. Diagnostic evaluation of suspected Ebola patient: fever, 380 C. Symptoms: headache, asthenia, myalgia, vomiting, diarrhea, abdominal pain or hemorrhage. History of travel to a country at risk: Sierra Leone, Liberia, Guinea, in the last 21 days since the onset of symptoms contact with a person with Ebola. Treatment. There is no general approved treatment for Ebola virus infection, only supportive care, specialized medical care to alleviate symptoms and prevent further complications or side effects. Ebola virus infection prevention measures for those traveling to risk areas. Washing hands with soap and water or alcohol-based liquid disinfectant, avoiding direct contact with blood or body fluids that may come from infected people. Avoiding touching objects that may have come into contact with blood or infected body fluids, needles or medical equipment. Avoiding direct contact with people who have died from Ebola virus infection. Avoiding contact with bats, primates or blood, fluids that could come from them. Avoiding places that could be inhabited by bats, caves, abandoned buildings, mining sites. Avoiding the consumption of raw meat preparations that could come from infected animals. Avoiding unprotected sexual contact. Avoiding centers treating patients with Ebola. YouTube channel at Alexandru. Thank you for watching this video clip to the end. I hope it was a video clip from which you learned something. Understand, if you like this video clip, don't forget ***** subscribe, give a like, a share on social networks, so your friends know cut this clip.